Hey guys, it's Dr. Brady here from True Health Center for Functional Medicine. We're going to talk about prostate cancer today and the direction functional medicine takes it as far as assessing it and addressing it. So, well, in fact, I just recently have an uncle who has prostate cancer currently, and it's getting really bad, so keep him in your thoughts, and I'm going to dedicate this talk to him. So, prostate cancer. Prostate cancer is usually first detected with a prostate exam and also a blood test called the PSA. And with this information, the prostate cancer is diagnosed. The thing with prostate cancer is that, just like with any cancer, it takes decades upon decades of gradual breakdown of the body system to ultimately develop cancer, and prostate cancer is no different. But the problem with our current healthcare in this country is that we wait till the disease actually occurs before anything is actually done. That's the way it's set up. If the prostate exam, if PSA is just slightly elevated or even within normal range, and the internal exam is normal, well, you're normal. But we know several things about prostate cancer and what affects prostate tissue. And there's only a few we want to hit on today. The first is estrogen. Now, estrogen is a female dominant hormone. We've all heard, my wife has too much estrogen. There's too much estrogen in this room. It's a female dominant hormone. However, this estrogen can become very elevated in men, especially as they age. And there's a process in the liver called glucuronidation. That's a long word for how estrogen breaks down so it can be eliminated from the body. Right? Because everything that our body makes ultimately needs to come out. Well, this is how estrogen does it, through that liver pathway. So, what we see in prostate cancer and in males is that there's an alteration in the way estrogen is broken down. Estrogen gets broken down into three main what's called metabolites, or the substance that it becomes so it can be excreted. These are called 2, 4, and 16 hydroxyestradiens. Long words, let's just keep them short. 2, 4, and 16. Okay. Now the 2s seem to be anti-proliferative, or it doesn't cause tissues to multiply fast. The 4s and 16s seem to do. In prostate cancer, we see that the 4s really upregulate the cell division of the prostate gland, and the 16s tend to be more proliferative for breast and cervical tissues in women. So this is what we see functionally. Now, functionally, we're speaking about how the body works as a whole to either create proper function or dysfunction. Okay, and all these things can be analyzed. Okay, they're not being analyzed today in today's healthcare system because we work in a disease model, not a functional model. So what we want to do with these estrogens, we can measure them in the urine. These 2s, 4s, and 16s, you take a urine test and you say, hi. Okay, and this is what should be done at physicals. A patient walks in, male patient, 55, 60 years old, and we take a urine sample, and we measure those 2, 4s, and 16s. And what we'll see, if this guy is at high risk, now, let's just say this guy had just left a medical physical exam, and his PSA was normal, and his internal exam was normal. Okay, so we test his four breakdowns of estrogen, and it was high. Well, what do we do? Like, oh no, this guy does have an increased risk of prostate cancer in the future, but there's things we can do about it now. So In this estrogen case, what we want to do is that we want to make sure that the liver clear, because remember, all this happens in the liver. We want to make sure the liver clearance system is working properly. There's tests you can do for that. You can, we won't get totally into it, but you can take something like aspirin and other substances, and they can be measured to see how fast they get metabolized and washed away, and that can be used to give a good measurement of how the liver is actually functioning. So if we see these bad estrogens in the urine, what we can do using substances that causes the production of the 2s, because we said the 2s are really good. We want a lot of 2s. We don't want a lot of 4s and a lot of 16s. We want those 2 estrogens. Now, there's several compounds that upregulate or help produce more of these 2s. One's called I3C, or endo-3-carbinol. This helps produce more of those 2s, and consequently lower the 4s and 16s. So ultimately, this can lower the risk of prostate cancer. Okay. So we measure that over a period of time, and we make sure that those levels get back to normal and stay at normal. Yes, this is healthcare we're talking about, okay, not sick care, because this patient doesn't currently have it. Now, if the patient did have it, can we do the same thing? Absolutely. In some cases, cancer gets so bad, you can't turn around, but what you can do is make the quality of life better for that patient and that person and their family, and give more quality years and quality months, quality weeks, whatever. One more quality day is important for these people. And our current healthcare system is failing. You know, only about 58% of prostate cancer patients live 15 years. We have. You know, and the majority of them will ultimately develop a reoccurrence prostate cancer, because after it's treated by either castration, radiation, or chemo, there's no one to take a look at their function. There's no one to take care of their individual physiological processes, because it's not being looked at. Our office visits are lasting 3 to 15 minutes, because the docs can only see patients that amount of time, because they have to go through them, run through them, right? So they can pay their malpractice insurance, right? So that's a subject for another day. So some other things we can do for prostate cancer is to make sure that that these men don't have high estrogens. Well, what causes high estrogens? Well, here's the thing, and on top of environmental exposures, because believe me, we are swimming in a sea of synthetic estrogens. If you're wearing a dry clean shirt, you're being exposed to estrogens, because some of the compounds and the chemicals they use imitate insulin and stimulate estrogen in the cells of the body. But one of the mechanisms in our body is called aromatization, and that's a long word for transforming testosterone, which is male dominant, right? Males have a lot of testosterone, but testosterone can be converted into estrogen by this enzyme called aromatase. So you'll see in some prostate cancer patients they'll be given testosterone, right? Are they being checked to see if that aromatization or their aromatase enzymes are upregulated? Because this is what happens in a lot of men, is that they convert the majority of their testosterone into estrogens. So even if they're taking exogenous or if they're injecting themselves with testosterone, that testosterone can ultimately convert over into estrogen. Now that's a heavier load on the liver. Now if the liver's producing a lot of those 4s anyways, well, when the body becomes more exposed to estrogens, they're going to make a lot more 4s, further increasing the risk of prostate cancer. You see how this is all starting to fit in as far as how function